We provide services in Northumberland and North Tyneside. We run 10 hospitals, 3 of which are district general hospitals, the others are community hospitals. We also provide community services for Northumberland and North Tyneside, covering a population of about 500,000. And we also provide social care services in Northumberland with a population of 320,000. Being an integrated care organisation, you might think that providing integrated care would be very easy. In fact, it's probably no different to providing care across by multiple organisations. What we have discovered, and we've spent many years looking at and being interested in integrated care, certainly at least 10 years. We know that there are multiple factors that you need to consider when developing integrated care. One of the key things, of course, is the people. So we have quite an extensive organisational development plan that focuses on breaking down boundaries between our clinicians, our staff, whether it be nurses, social workers or doctors, with the patients, and using that interaction to drive improvement in quality of the services, but also breaking down the boundaries between those staff that work in community settings and hospital settings. We will develop programs to help break down those barriers by sharing what each other do. We're going into the places in which they work. We also spend a long time breaking down the barriers between ourselves and primary care. We've introduced programs that help to develop the relationship with primary care, including compacts of behaviours that we expect our staff to do when they're working or interacting with primary care, to integrated care programs based around the primary care practices themselves. One of the key enablers that we've identified is around relationships. And that we know that although it sounds fairly soft, developing, enhancing, maintaining relationships, it's actually critical in making change, and certainly in developing integrated care services. We've learned from the past when relationships have been allowed to drift or they've been neglected in some way, that's actually put a halt to developing integrated services. And we learned from that, and so we spend a long time meeting with, discussing with, encouraging relationships, breaking down those barriers, those soft things that are hard to do. When you're measuring success, you need to be clear about what your objectives are. We've had a lot of discussion about what our objectives are. Is it around saving money? Is it around improving quality? Is it around more care in people's homes or in a community setting? So when measuring success, it needs to be measured against those outcomes. So we have already developed a number of those measures. Our plans for the future on integrated care are more of the same. I think we're already moving at pace and at scale. We have many initiatives. The last time I counted them, there were approaching 50 initiatives, all focused on those objectives of more care being managed at home, less in hospital, less bed days, and improving in particular the quality of the experience that our patients and our clients receive. My top tips would be focus on the relationships, work hard at the relationships, because it's those relationships that will bring you the results that you want, and be clear about what those results are. Be absolutely clear and consistent with the message. And third thing is follow that through in terms of behaviours, in that if things are agreed, things are said, then action takes place that actually follows that through. And the worst situation that you can be in, I believe, is that you're sitting around the table, hand in hand, singing songs and being happy together, but yet kicking each other's shins under the table. And if you find yourself in that place, that's a bad place to be.